of disease from major air pollution sources in China and India. Michael Brauer is a professor in the School of Population and Public Health at the University of British Columbia. His research focuses on linkages between the built environment and human health, with specific interest in transportation-related and biomass air pollution, the global health impacts of air pollution, and the relationships between multiple exposures mediated by urban form and population health. He has participated in monitoring and epidemiological studies throughout the world and serves on numerous international, national, and local advisory committees. Thank you.
Great, thank you. Thanks very much for the introduction. So as I said, I'm going to do a presentation on the air pollution situation as it relates to health in China and India, and these are some analyses that I've been working on over the last few years. Okay, and just before I get started, just a little bit of sort of basics for those of you who aren't air pollution experts on kind of what we know about air pollution and health, just to sort of set the stage. The first thing just to keep in mind, and for those of you who have heard me say this before, my apologies, but I tend to start out every talk with these slides. Air pollution, the risk for any one individual, even in some of these very highly polluted places that I'm going to be talking about, even in places like China and India, the risk for an individual is still small. So this is not like smoking. But we have a very large exposed population. So in aggregate, that leads to a very large population risk, and that's why air pollution is important from a population health perspective. The diseases impacted by air pollution have other causes. So I've been quoted many times saying nobody gets air pollution on their death certificate. So there's no way to actually tell from doing an exam, a diagnostic test, that somebody has actually been affected by air pollution or died from being exposed to air pollution. So all of our information that we know is actually from doing research studies, and when we do counts of deaths, how many people are affected, or the burden of disease from air pollution, that's all based on applying information from epidemiologic studies to our two populations. So we can't actually count in the same way that we could count motor vehicle collision-related deaths. And actually, this is no different than smoking, but it seems to get a lot more scrutiny than would something like smoking. So again, you don't get smoking on your death certificate, but nobody actually quibbles about did somebody or not die from smoking. And I think the reason for that is that if you go to your doctor, you get diagnosed with lung cancer, the doctor says, did you smoke? Then everybody makes that connection. The doctor never says, have you been exposed to air pollution? And even if they did ask you that question, what would you answer? So that's why this is actually a little bit challenging. So we actually have to think about air pollution as a contributing risk factor, and just keep that in mind because it will come up in some of the later parts of the talk. So just as we think about physical inactivity, diet, alcohol, smoking, contributing to the chronic diseases that are the main killers in most of the world now, air pollution is another one of those contributing risk factors, and that's really the correct way to think about it. So what do we know? We know from now studies that have been done in hundreds of cities around the world that on days with worse air quality, more people will die. These tend to be deaths that are occurring out of hospital and in the older population groups. We also know that if you happen to live in a more polluted city or a more polluted country, after adjusting for all other known risk factors related to mortality or cause-specific mortality, if you live in a more polluted city, you will die earlier than a person who lives in a less polluted city, again, adjusting for all individual level risk factors. And that even extends to neighborhoods. So if you live in a more polluted area of a city compared to somebody who lives in a less polluted area of a city, again, adjusting for individual risk factors, there's an increased risk of dying. So all of this means that actually air pollution is actually more dangerous than a shark attack, a plane crash, or terrorism. And and it's literally everywhere. It is everywhere. So how do we actually come up with these numbers? We need 4 different things to come up with these numbers. So one is obvious. We sort of need to know the level of exposure. And like most hazards, the level of exposure is related to the level of risk. It's not linear, but higher exposures do lead to higher risks. We need to know what is the pool of the population. That's here. What is the pool of the population that is being affected? So not everybody is affected by air pollution. And again, thinking about air pollution contributing to a disease, what we actually want to know is how many people have heart disease? How many people are dying from heart disease? What proportion of air pollution is air pollution contributing? And then we need to know the relationship between exposure and health. So this is actually all that's done in epidemiology. And then we have to compare exposure at whatever level we're considering to some optimal level. So that may be 0, but actually that 0 isn't correct for air pollution because there could never be 0 levels of air pollution because many of the pollutants have natural sources like volcanic emissions or dust, let's say, blowing, or lightning can create levels of pollution in the air. So we need to think about what that optimal level is, and then what we're doing is comparing people who have this level of exposure to the optimal level, looking at the relationship, that quantitative relationships, or the slope, let's say, between exposure and effect, and then how many people are in that pool of people that are affected by air pollution. So that's the methodology. So just to break it down a little bit, on a global basis, we can do this using a combination of satellite observations and ground monitoring to estimate exposure. The reason that we have to do this is that unlike places like Canada, where we have a fairly dense network of ground monitors, which are primary data source for understanding exposure to air pollution, many parts of the world actually don't have that information. So there's many countries that actually have no air quality monitoring. But even in a place like Canada, we've shown that the ground monitoring data that we have is not sufficient. So if you live in a rural part of the country, you have no monitoring. But even in our cities, actually, the ground monitoring is somewhat sparse, even in a place like Canada or BC that has a very dense monitoring network. So the satellite information adds to that. So we put these 2 data sources together. And it's quite a sophisticated sort of approach. We're actually looking at multiple satellites, combining the satellites, which are actually telling you the whole level of air pollution from where the satellite is down to the ground level. You need then a chemical transport model, which is a sophisticated physical model of how air pollution disperses and how it varies vertically in the atmosphere. That model tells you how much of the air pollution is actually at the surface. So you combine that with the satellite information and then combine all of that with available ground measurements to come up with this kind of an estimate. And we have this now available globally at about 11-kilometer resolution, again, for everywhere on Earth. What does that tell us? Well, this is sort of what the distribution of exposure is. This is to fine particles. Pretty much everything I'm going to talk about today is focused on fine particles, and that's because that's the class of pollutants or the mixture of pollutants that are most closely linked to health, to measures of health, and probably our best indicator of the health damaging aspect of air pollution. So you can see that there's variation over the world, some very high levels in North Africa and the Middle East that are primarily related to wind-blown mineral dust. Also high levels in North India that are combustion-driven, and I'll get into more of that in a bit. You see in China as well as some parts of Eastern Europe, elsewhere in the Middle East, some of the higher levels. 95% of the world's population is actually exposed at levels above the World Health Organization guideline, which is some kind of a measure. I wouldn't say that there's no evidence of health impacts below the World Health Organization guideline, but it is some measure of where we would like the world to be to minimize the health impacts, and actually 95% of the population is above that. Because of that, actually, the World Health Organization has different tiers because it's very sobering for a country to say that, like India, that where 99, and this is true, 99.9% of the population is exposed above the World Health Organization guideline. That's very sobering. So they've actually set interim targets where India may say, well, we want to get to the interim target in the next 10 years and then move slowly down to achieving the World Health Organization guideline. Canada is one country that actually most of the population is below the World Health Organization guideline, but that's not true for most of the world's population. So that's sort of exposure. Now we'll talk sort of about effect size and the optimal level. So we actually combine information from all sort of high quality studies, so cohort and case control studies of long-term exposure to air pollution, and focusing on a particular set of diseases where there's high quality evidence and biological plausibility to link them with air pollution. So just tabulating the effect estimates from the studies, and then we also use these studies to understand sort of what that low optimal level should be. And so we take sort of the lower levels that have been observed in these studies as an estimate of the optimal level. Again, because of that issue is it can't be zero. And then this is the relationship that we pull from these studies, which is essentially that exposure response relationship. So here on the y-axis is the level of risk. Here's the concentration, and you can see you get these sort of nonlinear relationships in most cases. Just as a little bit of an aside, most of this talk is going to focus on China and India, and I'll show you why in a second. In Canada, the situation is that even though we have these very, very low levels, we still see this kind of relationship between the risk of dying from different diseases and the level of particulate matter air pollution. Again, so here's the World Health Organization guideline at 10. We can still see a increasing risk at levels well below that World Health Organization guideline. So really at present now, there's no evidence of a safe level or of a threshold. So everybody is exposed to high levels of air pollution. The other reason that makes air pollution important is that it affects some of the leading causes of disease in the world. And so ischemic heart disease, the leading cause of disease in the world, cerebrovascular disease, which is stroke. The second, lower respiratory infections, primarily pneumonia. The third, so 3 of the top 5, and then you can see also number 8, chronic obstructive pulmonary disease, and then lung cancer. And this is now looking at a measure of disease called the disability adjusted life year, which is years of life lost, so prematurely dying from a disease, as well as years of living with that disease. So it weights diseases that affect people earlier in life more so than later in life, as well as diseases that affect people over long periods of time. So something like lung cancer, which is actually a leading cause of death, would rank much more highly, but because actually people don't live with lung cancer very long, from this measure of disability adjusted life year, it's actually down-weighted. So I believe it's actually in the top 5 or so causes of death globally. So these are the diseases that we have strong evidence to link them, so where we think there's a causal linkage between exposure to particulate matter in the air and death. Of course, and that's consistent with World Health Organization assessments, US EPA assessments, et cetera. But we now are getting evidence, emerging evidence of other diseases. So thinking about actually what else might be included in the future. Things like asthma, low birth weight, preterm birth, diabetes, so all things we've studied a lot actually in our work here. And growing evidence for even things like cognitive development in children, cognitive decline in older adults, effects on mental health, even effects on obesity, for example. So the scope of diseases affected by air pollution is also not static. As we do more research, we're actually finding more and more things that tend to be affected. So putting, again, all of this together, so high exposure, high prevalence diseases, the end result is that air pollution is one of the leading risk factors for death in the world. So this is an analysis done as part of a very large international project called the Global Burden of Disease that is enumerating causes of death and disability for everyone, so all countries around the world, and how that changes over time. And then once it's done that, it actually says what risk factors are important. So first, what are people dying from? How does that vary by sex, by age, by country? And then what are the risk factors for those things? So you can see that the leading risk factor for death globally is high blood pressure. Smoking is second, so smoking kills about 6 million people every year. But particulate matter, air pollution, is not far behind. And the estimates are about 4 million deaths in 2016 globally from particulate matter exposure. And it's staggering, that's sort of 7.5% of the global total. So on the same sort of order of magnitude as high cholesterol, larger than alcohol use, larger than high sodium, larger than low physical activity, things that actually may get a lot more attention. And then other air pollutants, so ozone, much lower impacts. And again, this is why I'm sort of focusing on particulate matter. And again, you can see where other things rank in here globally. So here's why China and India, of those 4 million deaths, over half of them are actually occurring in China and India. Part of that's obvious. Those are two very large countries, so about 1 billion people each in China and India. But there are also countries that tend to have high levels of air pollution. So again, putting those two together, that's why it's sort of obvious. This is just looking a little bit at trends from 1990 to 2015 in these two countries. You can see there's been an increase in the number of deaths attributable to air pollution in China and in India. Part of that's a result of increase in the population, and especially in India, the population is still growing quite rapidly. China, it's not. But also the population is aging. And most of those diseases are actually diseases of aging. So as more people age and develop those diseases, they're more likely to be affected by air pollution. But even if you adjust for population size, in China there's still been an increase. In India, it's stable. There's been a small decrease in the per capita deaths, and in both countries, large increases in the proportion of all deaths that are attributable to air pollution. Again, if you're sort of slicing up the pie, how much has air pollution, of a role does air pollution play, that's increased over time, over the 25 years. So the question really then is, if air pollution is a major health risk factor, and you can see in India, so again, this is the same ranking I showed you globally, but now for India, it's the third leading risk factor for death in India. And China, it's number 5. So if it's a major health risk factor, then the question is, what are actually the most important sources that we actually need to act on to control the problem, right? So that's sort of the obvious next question. And that's complicated because air pollution is a complex mixture. And even though I'm talking only about one type of air pollution, particulate matter, it's actually not very different. Particulate matter itself is a complex mixture. So we're talking particles that we may breathe in coming from different sources. They all get mixed together. And even a single particle actually has contributions from multiple sources because it's a dynamic system in the atmosphere. So we have all of these different sources. They all get mixed together and get processed in the atmosphere. So you can think of all these sources contributing emissions into the air. They get acted upon by sunlight. They get acted upon by, or they mix together and react with each other. And there's all this processing that goes on, and even we have examples of gases being converted into particles, particles actually being in equilibrium with gases that depend on the temperature. So the system is always dynamic and quite complex. So how do we now do this? So it's not enough, I guess, just to go back, it's not enough to just say, well, how much is being emitted from the different sources and then adding that up. You actually have to consider sort of all the atmospheric processing that goes on. So how do we actually estimate the impact of sources? So the first thing we need to do is actually enumerate what all those sources are, and that's called an emissions inventory, and essentially that is a very, very exotic counting exercise. If you just take the example of vehicles, you want to count every vehicle, and you want to measure what comes out of every vehicle under the conditions that they're used. So some of you may have heard of the VW Dieselgate scandal, yes? Yeah? So that's actually an issue of where we were doing testing for regulatory purposes, but also the same data actually goes into emissions inventories of the vehicles. And so what you're doing is measuring what comes out of the tailpipe, and what happened is under the testing conditions, what's coming out of the tailpipe, or what's measured to come out of the tailpipe is very different than actually what comes out of the tailpipe in the real world. So you have different ways of doing this for different sources, but the goal is to understand under real world conditions what's actually being emitted into the air. And not just for vehicles, you think about things like an industrial facility, you think about a power plant, you think about even something like a restaurant or a coffee roasting operation, what's actually going up into the air. And you count all of this and try and do this, let's say, for every source that exists. So it's obviously a very complex process and quite challenging. But let's say you can do that to some degree of accuracy. And then you'd also like to say, well, how are things maybe going to change in the future? So again, the countries are dynamic, they're changing, we're getting new technologies all the time, populations are growing, so we're getting an increasing population, we may have more vehicles. I'll show you some data from China and India where a major source is burning of agricultural land when they burn crop waste. You think about populations growing, they're going to need more agriculture to feed those growing populations, so there's going to be more burning. So again, all of this is going to change depending on the future sort of scenarios for those countries. So that's part of what's been done. And I have colleagues, fortunately, that do that very painful work because it's really very difficult to do. And then you use what's called the chemical transport model, where you are essentially letting those emissions go into the air, saying, here's the meteorology, here's the chemistry that's happening, let's get all that processing going on and what actually results. And again, that's important because it's not just what goes into the air, it's actually what happens to it, and even how it interacts with other things that go into the air. Now you do that, and let's say you do that understanding all the emissions, but let's say I want to isolate the impact of power plants. The nice thing that I can do in these simulation models is then I can turn off all the power plants, and I can say I'm going to create a world that has no power plants. And now I'm going to rerun the model. Again, all the atmospheric processing is happening. And now I've got two scenarios, one where all the sources are there, one where I've removed a source. And then you compare the difference. And again, that's accounting for all that nonlinearity, all that atmospheric processing. So that's the way you get the fraction that's contributed by a particular source. So what proportion of the total? Now, these models are really good and they're great, but they're not perfect. And they tend to be biased and either high or low compared to real-world observations of what the level of pollution is. So think of these as a model that is trying to be a mathematical approximation of how the atmosphere works. And that's very difficult. It's probably impossible to get ever perfect. But we do have a closer to perfect picture of the level of pollution, and that's that information that we have from the monitoring that we do, the satellite observations. So we actually put those things together, and essentially what we're doing is we're taking that satellite and ground measurement-based product and normalizing what we get from the model to that to sort of make it accurate in terms of the levels. So we take that information. From that, we've got now what is the contribution of each source to actually what do we see in the air, what are people exposed to, and then we apply those exposure response functions, the information on how many people have different diseases, and then what we can do is get the distribution of diseases from each of those sources. Okay, so that's all the methods I think I'm going to talk about. Let's get into some results. So here's China. So we looked at these sort of major source categories. In China, there's a lot of emphasis on coal and basically trying to understand sort of how much coal should China be using in the future versus other energy sources. Coal is inexpensive. It's also highly polluting. Most of China's sort of industrial history is based on coal. And those of you who sort of followed this at all in the media, you know that there's sort of now a lot of concern about air pollution in China, and there's a real question both from an air pollution perspective, but also from a climate perspective, greenhouse gas emissions perspective. Basically, how much coal should China be using? How quickly should China transition away from coal? So what we found was that in total, 40% of the, and this is now population-weighted concentration of particulate matter. So what we're doing is we're not just saying how much goes into the atmosphere in China, but actually weighting it towards where people are. That's actually what makes this an exposure measure. 40% of it is from coal, and you can break this down into the different sectors. So both industrial combustion of coal, power plant emissions, and as well as domestic or residential. So this is people burning coal for heating or cooking, primarily in rural areas. Non-coal, so this is industrial sources that aren't focused on coal. Transportation, so that includes motor vehicles, but also shipping and rail. This is burning of biomass for heating and cooking, again, primarily in rural areas, and then this is that open agricultural burning. So these are sort of how the percentages break down on a population-weighted basis nationally. What you also get out of these simulations and all the information is how that varies spatially. So this is just looking at total coal. Here's power plant coal, and you can see there's sort of higher contributions of power plant coal in the areas where there's more power plants. Surprise, surprise, right? Different distribution spatially for this residential use of coal. So it's somewhat higher in the more rural areas of China, actually a little bit lower in sort of the eastern part that's more urbanized. What does that mean in terms of disease burden and death? So this is how it breaks down. In total, this is the base year that we use is the year 2013. Around 900,000 deaths that year from air pollution, over 350,000 from coal. If you sum up both industrial sources, coal and non-coal, that's about 250,000. And I think rather surprising to us, so this residential sector, so again, this is burning of wood or coal for heating or cooking, almost 200,000 deaths attributable to that. So much higher, or let's say substantially higher than something that gets a lot more attention, which would be transportation, for example. You can also look at how this breaks down again across the country, and there sort of are differences. So just to take some examples, so here's Beijing, and you can see quite a high proportion from transportation. That makes sense. It's an urban center, so a lot of vehicles, but also a lot of freight. going through Beijing. You can also see the influence of sort of power plants there. And then another example, so here's Sichuan province, so a much higher contribution from industrial sources there. Also sort of high contributions from burning of biomass, again, for cooking in that region. So the sources actually change, and their relative impact as well as their magnitude change spatially. Again, this is the kind of information that you'd like to have to start to manage the problem. So that's all sort of present day, and then probably the more important part is sort of what about the future? And we looked at with our colleagues in China on 4 different sort of future scenarios. So what you're doing here now is you're taking that emissions inventory and you're saying, well, what if we change things? So what if all the cars are clean? What if we got rid of burning of coal for heating? But you don't just make wild assumptions. You actually do things that are sort of reasonable and feasible. So we did sort of 4 combinations, which are combinations of energy policies. So this would be this sort of business as usual is basically current legislation and implementation. So these are things that are already regulated on the books, and this is at the end of 2012. And then we said another sort of a more aggressive thing would be additional energy saving policies, generally aligned with things that the government is likely to do to meet their greenhouse gas emissions targets. So these are not crazy wild things. These are things that haven't been legislated but are likely to occur. So that's sort of looking at, and that would be things like changing the mix of energy. How much alternative energy sources, renewable energy sources, let's say, are going to be used. How much natural gas is going to be used instead of coal. How much efficiencies can we get by modernizing, et cetera. And then we looked at pollution control. So this is basically how much can you clean things up. 2 different scenarios. So again, things that have already been planned in terms of what's going to be required. So what does the government require for power plants, for industrial facilities? And this is already occurring now after the government started to get serious about air pollution. And then a more aggressive thing, which would be sort of the maximum feasible things, pretty much regardless of cost. So what technology is currently available? So this is not technology that's not available. What's currently available that could be implemented, but without sort of considering whether it would be or what the cost implications are. So business as usual 1 and 2, which basically focus on the same energy policy, and then there's this 2 different scenarios that are focused on different energy saving policies. So here's sort of the overall results, and what I'm showing you here is the numbers of deaths broken down by cause. This is the level of exposure, and this is all historical. And then these are the future scenarios. So a couple things to keep in mind is that the pool of these deaths is changing because the population is growing, the population may be aging, and there actually may be progress on some of the diseases. So some things, for example, this is acute lower respiratory infections. That's something that has been going down. And it's been going down because of better treatment. So there's actually a vaccine. There's better health care in terms of antibiotic use. So pneumonia, which in Canada still does kill people, but it's nowhere near as big of a killer in Canada as it was, for example, in China in 1990. Sorry, that's the blue one. This is the lung cancer here. So you can see actually that the proportion from pneumonia is actually going down over time, even as the population ages and as the population grows. So again, all of this is dynamic and it's changing. So the good thing is that if you look at these various different scenarios, in all cases, actually, the level of exposure goes down, and as you implement more aggressive either pollution control and energy use scenarios, the exposure goes down even more. And this would suggest in the year 2030 that the levels would be around 25 micrograms per cubic meter on a population-weighted average. Just to put it in perspective, in Canada we're at about 6, though, so there's still room to improve even beyond that, but a pretty dramatic improvement. The sobering news, though, is that from a death perspective, no matter what you do, you can see actually the numbers are higher. And again, that's because of not so much in China because the population is growing, but because the population is aging. And in fact, even healthcare is actually improving in China. So it's really mostly population aging that is affecting that. And that's sort of a good news, bad news story. It's good that people are living longer, but they're living longer so that air pollution can kill them. You can take that as a good news, bad news story, I guess. So this is just showing that this sort of same phenomenon now globally, this is the globally as well as the 10 most populated countries in the world, the same trend has been happening over time. And what I'm doing here, let's take China, just decomposing. This is the black is the net change in the mortality, the deaths from air pollution over the last 25 years as a function of population growth, population aging, exposure, and then this is the mortality rate. So all this is good. The mortality rate is decreasing. Less people are dying in general, and less people are dying from heart and lung disease per capita in China than so this is good, but it's not enough to overwhelm essentially this increase in population aging combined with population growth and this increase in exposure. You can contrast that with some situation like in the U.S., where there's actually been a decrease in the number of people that have been whose deaths are attributable to air pollution, and that's because in addition to this improvement in the mortality rate or a decrease in the mortality rate, you've also had a decrease in exposure that has been larger than the increase in population and the aging of the population. So only in the countries actually where you do sort of have this decrease in exposure is there sort of a net decrease. Everywhere else in the world, sort of these things add up, and they're larger than the impact of basically improved health. Just to give a little more granularity, when you look on the future scenarios, also the sources change. And again, this is sort of good. You can see, for example, so starting at the top, this is sort of the year 2013, and then these are the different future scenarios, kind of moving down and sort of increasing stringency. So the impact of transportation actually decreases. That's good. Cars are getting cleaner. Other things, though, don't go in that direction. The increase, there's expected to be an increase in industrial emissions, so increase in deaths from non-coal industrial sources. Decrease in things like open burning of agricultural land, decreases in the residential fuel use, et cetera. So some positive things, but overall, in fact, in terms of the coal story, coal is always, even in 2030 by our estimates, it's going to remain the single largest contributor to health burden, and its impact is likely to get worse under all scenarios. And again, part of this is due to that population aging. If you normalize, so let's take out the population size, and we're taking out age now, so we're age standardizing. So these are age standardized death rates. You can see actually clearly that the rates actually drop down in relation to all the sort of increasing stringency of the control in each of the scenarios. So this is showing that you still want to do things, even though the total numbers, there's not much you can do about them, but you still get a decrease in rate. So this should be continued, and at some point you actually will start getting benefits in terms of the total numbers. So let's change gears and go to India. So India is a little bit of a different situation in that if you think about the development trajectory, India is not as advanced as China. Neither of them are sort of as highly developed economically as a country like Canada. So India actually still has a large segment of the population that doesn't have access to electricity. China, actually, everybody does. So India actually still needs to do lots of things, and access to electricity is a good thing. It's good for health, it's good for education, it's good for lots of things, but there's a pollution cost to that, because you probably need to provide some of that electricity by combustion sources, or maybe you don't need to, but that's likely to happen. So just consider that India is not where China is, and neither of them are where Canada is. So we do the same kind of thing, but in India we actually looked at some different sources, so we actually have to think about which source sectors are relevant to India, and there's sort of different things that you might want to consider. So distributed diesel are actually small diesel generators that any of you who've been to India, you see them all over the place. So they power things like cell phone towers, they power agricultural pumps, they power actually a lot of restaurants or facilities actually need power and can't rely on the grid system that actually may be intermittent and may not actually be providing power 24/7, so things that you don't want to go down. So you actually see thousands of diesel generators throughout the country. India has also some coal combustion for industry and power, but nowhere near the level at which China has, and that's sort of a decision. Again, India needs more power. How are they going to do it? What is the cost? If they go for coal, they can actually see what's happened in China. Do they want to go there? Do they want to go another route? And again, this is the kind of information that hopefully can help in that discussion. Open burning, so if you followed any of that sort of in the press, this is primarily in Punjab. This is what happens seasonally, especially burning rice stubble, affects Delhi, and Delhi, I don't know, is that on? All right, well I just switched it off and on, let's see. Okay, where was I? Oh, so this is what leads to some of the very high episodes in wintertime in Delhi, so they're exacerbated by this open burning. And then very important is this residential burning of biomass. So this is dung, crop waste, wood primarily, which you can see is very prominent in sort of the densely populated areas of North India. So we looked at some sort of different sources. So as I mentioned before, 99.9% of the Indian population lives in areas above the World Health Organization guideline, but actually 90% are in areas above. No worries. So, and even 90% of the population in India lives above this World Health Organization interim target. In fact, this is India's air quality standard. So they're not even, thinking really about getting to the World Health Organization guideline. And recall, as I showed you, most of Canada's below that, and we still demonstrate health effects quite large, actually, in the Canadian population, well below the World Health Organization guideline. So this is unfortunately not a problem that's going to go away in any time soon. So again, this is now just after normalizing, again, for including the ground monitoring and the satellite information. You can see spatially how things vary across the country. And again, looking at the breakdown by these sort of source sectors, so again, about 1 million people dying in 2015, which is sort of the base year for this analysis. The largest sort of single source may surprise people. Most of the media attention is on things like transportation, and to some extent on open burning, but it's this residential burning of biomass. That's the largest single source contribution. And I think those of you who know something about this source will also appreciate that. So what I'm talking about is how this contributes to outdoor air pollution, but for people actually living in households that are cooking or heating in this way, there's also an added risk for those people. And that's known to contribute again globally about 3 million deaths in the world, or 2.5 million deaths in the world. So if you think about controlling this source sector, it has a large benefit in terms of its contribution to outdoor air pollution, that is actually regional. So this is looking, so this is how it's actually contributing throughout the whole country of India. And just again, put it in perspective, anything that's above yellow is much higher than the World Health Organization guideline. So some very high levels, regardless of actually how you are cooking in your own home. So you could actually get sort of multiple benefits from reducing this source. Another sort of interesting finding is that unlike, again, a lot of the rhetoric, which tends to focus on the major cities, most of the burden falls on the rural population. That's not a huge surprise. Most of the Indian population is still rural, and I forget exactly, but I think it's I think it's 67% of the population is rural, but I may have that wrong. So that sort of makes sense. Most of the population is rural. But if you sort of look at this, and now this is sort of adjusting for the population size, there's sort of certain sources that disproportionately affect the rural population. So the distributed diesel, obviously that residential biomass, because that mostly occurs in rural areas, open burning, but even things like transportation and brick production, they're disproportionately affecting the rural population compared to sort of all sources of particulate matter. And some of this, actually, there's a reason for that. One of the first things, for example, that Delhi did to control the air pollution in the city was they banned actually brick production in the city. So what you see now is actually there's brick kilns lining. You can actually see the boundary of the city by where the brick kilns are. And this is sort of a typical, and China is actually no different. There's no power plants in Beijing now, but Beijing is ringed by a bunch of power plants. So now you've taken sort of an urban problem, and it has had some benefits in terms of urban air quality, but you've now created a regional air pollution problem and actually haven't really solved the problem. So you just kind of moved it around. Maybe there's some sort of exposure benefit. But again, this is sort of different than the rhetoric that most of the population in India is rural, and there's sources that are even worse, have a worse of an impact on the rural population. Again, quite different than sort of what all the emphasis is on the cities. Same kind of thing, evaluating future scenarios. So we had 3 different scenarios. And I would say in India, so there's a reference scenario which is very similar to the one in China, current legislation and technology. So India is still developing, and it's sort of taking those same trends of improved technology that are already occurring. And then sort of an ambitious scenario that basically is what India is doing for greenhouse gas emissions, current environmental legislation and standards, so things that are proposed and are I think somewhat ambitious, but actually India seems to be on track to meet their greenhouse gas emissions targets. But then there's a very, very tough aspirational scenario, which is saying like by 2050 there's going to be no more traditional biomass burning at all in India, no more open field burning. 85% of the electricity is going to come from non-coal sources, so heavy use of renewable sources. So this is feasible, but I would say very, very difficult to achieve. And this is just more and more detail, but I think I'm going to speed things up. What you can see, so reference, so this is, we looked at 2 different periods, the year 2030 and the year 2050. So this is the reference, this is that middle scenario and the more aggressive one. At the year 2030, things sort of look like they improve if you go in these 2 different scenarios. So even this middle scenario, which I think is quite feasible, you actually do get some improvement. By 2050, however, this middle scenario isn't enough. And this is because the population has grown, and not because, so this is just pollution, but because when the population grows, you need things like more food, more transportation, more energy, etc. So the growth in the population is actually counteracting any of the improvements that you might make. And certainly if you do nothing, things are going to get a lot worse. compared to current day or 2030. So it's only this sort of aggressive scenario that will sort of improve things by the year 2050. So perhaps the path that you need to take is sort of, hit this level by 2030 and this level by 2050. Again, here's sort of the same sort of plot that I showed you for China. So unlike China, where the sort of concentrations have stabilized, in India they're still going up and likely to probably continue going up for some time. By 2030, depending on which scenario, you may start to see decreases, only if you hit that sort of aggressive scenario. And the concentrations will, doing nothing, they'll continue to go up to 2050. Only in that aggressive scenario do you get some improvement from sort of current conditions. But because of population growth, aging, et cetera, the total number of people that are expected to be killed by air pollution will increase both in 2030 and in 2050. And it's really only kind of this aggressive scenario that'll even kind of keep things close to the level where you are now, which is sort of 1 million people dying every year. The source contributions will also change, but let's move on from this. And again, just if you normalize by population size and age structure, you can see that these sort of increasing control scenarios, you do get some benefits. So just to sum up, this I think is both sets of analyses are among the more sophisticated that have been done. It's sort of state-of-the-art, updated data on emissions, really bottom-up emissions inventories that are very detailed, working with our collaborators in China and India. We also have this information on exposure and health burden at very fine resolution. Comprehensive, we have both national and subnational. We looked at future scenarios. But anytime you're doing future scenarios, that's what they are. Okay. And especially like the health and demographic trends. I think the demographic trends are rather clear. Health trends are not. And hopefully things will improve faster than we're predicting now. You may have picked up that in terms of toxicity, we're basically treating pollution from all sources equally. So we're not saying that if pollution comes from coal, it's any more harmful than coming from burning crop waste. That's sort of the standard assumption, because despite about 30 years of research to try and tease that apart, people haven't been able to do it consistently. But I think underlying that, everybody believes that there are actually differences. We just haven't really been able to consistently uncover those, and partly that is because you're exposed to a mixture. So again, think about if you're sitting in Delhi, you're not actually exposed to one particle type. You're exposed to thousands of different particle types that have actually been processed in the atmosphere. But that is a limitation. The resolution, the spatial resolution, is probably not fine enough to estimate the transportation impacts in urban areas. So it maybe underestimates that in the urban areas. We're also not considering the impacts of pollution produced in China and India on other countries. I've worked on other analyses that have done that, but this work didn't do that. And we're also not really considering, even though they're included in a model, I'm not accounting for, let's say, power plants in other countries that are affecting China and India. They are part of the modeling, but I didn't quantify their impact in terms of when I say power plants. That just means power plants in those countries. And then, as I mentioned, we're only focusing on particulate matter. There are other pollutants that are health damaging. So just to wrap up, coal is really important in China, as well as this residential source. And in India, the key things, I think, that, again, the residential source, and that most of this is affecting the rural population. And in both countries, you see that the demographics become really important, so that the overall situation is likely to get worse, even if pollution stays the same or improves slightly. But that shouldn't stop you, because improving pollution actually averts a large number of deaths that could occur. And I think I'm near the end of time, but I can take a couple questions.
Thank you so much, Mike. We have just about 3-4 minutes to take a few questions. No, you can keep that one, and we'll try to have the batteries last a little longer. So while the audience here can think about their questions, I have a few online, and I'll start backwards. So the first question goes like this. I would expect and have observed a lot of outdoor waste burning in India. This is apparent in places that aren't served by local waste management and centralized incinerators, like slums. Would this source be captured in residential biomass? What about burning of plastics and other waste products?
So short answer is that source is captured. We didn't single it out as a source that we quantified. So it's included in the simulations, and it's basically in an other category that we didn't quantify.
I was just wondering if you were looking at morbidity outcomes instead of the mortality outcomes. Do you think you'd see roughly the same kind of trends and shapes and patterns, or would you see? Or are there some aspects that would be significantly different?
Yeah, so we do have a measure of morbidity in that. So I could have actually showed you disability adjusted life years. The one that would change, so it would change up slightly in that pneumonia, especially childhood pneumonia. It would kind of raise up a little bit more, but it's something that is going down rapidly even in India. So it would actually make the India situation a little bit worse than China, but it's actually, fortunately, that's improving. So there are other morbidity outcomes, again, that sort of, we're gaining strength of evidence that could be included that may shift things a little bit. But in terms of the big numbers, I don't think there's anything that would really change things dramatically. You can think about asthma, and it's just not as big as these things.
Yeah, it is. It is time. Thank you so much, Mike, for this, and thanks for your patience with our little technical issues. Have a great weekend.